Counties in the Lake region have been reporting increased COVID-19 infection numbers in the last few weeks, painting a grim picture to efforts to contain the pandemic. The counties of Kisumu, Siaya, Busia, Kakamega, Migori, Homa Bay and Kisii are now on high alert. Our Rift region correspondent Bridget Ngana joins us now live from Nakuru for more on this. Bridget, can you paint us a picture of what the situation is like in those counties?
Duly so, Olive, we have seen that the western region is really crumbling under the pressure of COVID-19 infections, and we'll start in Kisumu, where since March last year, apart from testing more than 43,000 people in Kisumu, right now there are about 5,994 cases that have been recorded for COVID-19 since March 2020. The positivity rate, is around 28.4% right now, and the active cases that we are having at the moment in terms of COVID-19 is 687 who are actively infected with this virus. About 112 of them are hospital submissions. The county government of Kisumu has come out to say that they are already overwhelmed in their private and public facilities in dealing with this surge in infections. And at the moment, there have been 139 deaths since this pandemic began, and that is since March last year. We'll move on to Siaya County, which is a neighbor to Kisumu County. And since March last year, there have been reported 1,839 cases of COVID-19. And as at now, in the last 14 days, the county has reported 183 cases of COVID-19. The positivity rate right now in the county of Siaya is 11% and just about 2% in the last 24 hours, also experiencing a peak in infections after a period of calm rather. And right now we also move on to Busia County, and right now in Busia, since March last year, there have been recorded 2,183 cases of COVID-19, 21 deaths since March last year, 2020, and now they have 2 isolation facilities in Busia County. In Siaya, I'd rather mention there is only 1 isolation facility, and right now, the number of people who have died in Busia since March 2020 is 21 people who have died from the virus. The vaccination is also ongoing. The Ministry of Health began vaccinating the second dose of the AstraZeneca, and right now, in Busia, we have about 2,346 people who have been vaccinated. And I'll just take you back to Kisumu, where more than 35,000 people have been vaccinated in Kisumu County. But the second phase of vaccination is ongoing, Olive.
All right. So, Bridget, could these numbers be on account of the deadly Delta variant, which first originated or was first detected in Kisumu, having originated in India?
Definitely, Olive, we have seen how this variant ravaged India in terms of the death toll and also the severity of infections. And we're seeing this being replicated, especially in Kisumu County, which has become the epicenter. And it could be linked to a super spreader event, and that is the Madaraka Day celebrations as the main event for the super spreader event, where now we're seeing the surge in infections. And also there are other activities ongoing in terms of the ones the Ministry of Health had allowed the country to go on with. These gatherings in churches, in funerals, in events, but now we're seeing also the Kisumu County government taking a turn in its decision regarding this gatherings or events.
Okay. Bridget, we've seen Kisumu County putting in certain measures to contain the spread of the variant within its borders. What are some of the other counties you've mentioned doing in order to contain it in public spaces?
Initially, when we had reported the case of this Delta variant, the first cases in Kisumu County, we had seen other counties moving in to prohibit patients, COVID-19 patients for this matter, coming into their COVID-19 treatment facilities. But we are seeing also, for example, in Kakamega, I can mention that we're having people reinventing the wheel and trying to get into this county, trying to get treatment for COVID-19 because Kisumu is already overstretched, and they are disguising themselves, asking friends, asking relatives to really seek for them opportunities or beds in the public facilities they're in. But remember again, Olive, that when we did have a slowdown of the virus infections in the country, when we met the 5% positivity rate after the closure of the 5 counties, that was Nakuru, Mombasa, Nairobi, and Kajiado all the way to Machakos, that did have an impact in terms of slowing down the infection rate. And so what happened is that the isolation facilities that the government had put in place when the pandemic was just setting foot in the country have been left or did lie idle for some time because people did adhere to the COVID-19 protocols. But what we're seeing happen in Kisumu right now is that they're revising the measures. Kisumu is being treated as a sensitive place, a place where right now they've banned public gatherings, they've banned funerals, they've banned in terms of churches, people are going to go to churches. Any event rather has been banned. People are being advised to worship or do their activities, public activities rather, at home. And also one of the things that the county government has put in place is that as at today, the 48-hour period to dispose of dead bodies is lapsing. And for those who might have not have picked up their kin from the mortuaries within Kisumu County, they'll be forced to have their kin buried en masse, and these are in public or in mass graves, the kin also being treated as unclaimed bodies. And this is just the pressure that we are seeing the Kisumu County government is coming under as it tries to contain the virus. Another thing that they've done is that they're having public crackdowns. So anyone within Kisumu County who's not adhering to the COVID-19 protocols of wearing their masks or sanitizing when in public, they have been arrested. About more than 100 people have been arrested so far, and they are going to be presented to court. But this county is really crumbling under pressure. Bars also have been cracked down on because they're not also adhering to the curfew hours that have been put in place by the president and also the Ministry of Health. So right now, the people of Kisumu are being told to adhere to the COVID-19 protocols, to wear their masks, to sanitize, to distance themselves, as they seem also to crumble under the pressure of the infection that is now seemingly deemed as very deadly and also spreading quite fast.